So, a very good afternoon to one and all present over here. My name is Devansh Negi, and today I'm along with my co-presenter Bhavya and Shruti gonna present our topic that is a spatial distribution of critical disaster management facilities, a GIS-based approach of Maha Kumbh Prayagraj. So, in this spatial occasion of SOTM India, and which is the like co-part of FOSS4G Asia 2026, so we have got this opportunity, and we are very privileged for being the part of this conference. Talking about the problem statement, so as we know that Maha Kumbh Mela and other Kumbh Mela are one of the biggest mass gathering in our whole country. So we have done the work on this particular thing because there is a lot of problem of disaster. As we have seen in the Maha Kumbh 2025, there was a problem of stampede also. So there can be a lot of problems over there, like in terms of infrastructure, like health facilities, if there is police station facilities or not, fire stations are there or not, toilets, or camps, transportation, etc. So currently, there is an absence of systematic GIS analysis because as we have seen in the past disaster occurred over there. So there is still a lack of a lot of facilities which are not like GIS mapped, which are not that much linked with the GIS and the remote sensing technology. So basically, we have worked in this particular thing only. So our objectives are to collect and compile the spatial and non-spatial data of critical facilities like medical, police, fire station, shelter, CCTV, guard, sanitation, parking, etc. And during the Mahakumbh. Second is to assess the level of preparedness and the coordination by analyzing the facilities across the different sectors of Prayagraj Kumbh Mela. And the third is to suggest recommendation for the decision making for future mass gathering.
Coming to data source and methodology, so our data acquisition process totally relies on secondary data, including the official websites or journals, etc. We have used OpenStreetMap as a tool in QGIS software to extract spatial features such as health facilities and fire stations, etc. Through this, we have analyzed the data and created maps to analyze it further. We have opted for Prayagraj district in Uttar Pradesh as a study area. The region characteristics include low-lying floodplain, flat terrain and sandy riverbanks which make it highly vulnerable during major events like Mahakumbh Mela. Talking about relevance, as it has been already mentioned, that there has not been any systematic GIS analysis on this study. So our study fulfill this gap, and we are studying here to cover the spatial gap of this.
So coming to the result portion, as you can see, the medical and healthcare facility distribution over that particular region. So the hospital and health center are like extremely spatially distributed or concentrated in the central main city area only. And if you look at the peripheral areas or the suburban areas which are like apart from the main city, so they're still lacking behind the healthcare facilities, and that is one of the major problem in that particular area. Coming to the police station and the security infrastructure, so as we can see that the green points are the police station, and again they are in the middle or the center area of the city, and still the peripheral areas or the semi-urban areas or the village area of the Mahakumbh sectors are still lacking behind this particular police station thing. So again, it is one of the drawback for a disaster management facility, because if there is any sort of disaster and if there is no police station or any such security infrastructure, so it is again a problem for people or the local citizens. Then there is fire station and emergency gap also, because as we can see the red color showing the fire station, there is only one single major fire station in the Prayagraj, which is again the major problem of that particular region, because if there is any sort of fire hazard or fire disaster in the peripheral area of the sectors, so yeah, it can be a one of the like major problem, because roads and networks are still not that much connected to those areas. Integrating with the transportation accessibility, so yeah, again major roads are there, railways are there, bus stops are there, but still they are concentrated and highly like congested in particular city area only. Although some sectors are covered through the road networks, but still the peripheral areas are not well integrated with that. So if there is like any mass surge events, so these bottlenecks severely compromise the evacuation capacity and the ability of emergency vehicles. Then we have sanitation and public facilities, and when I'm talking about the sanitation public facilities, it is like majorly focusing on the public toilets, if it is there or not during the Mahakumbh or any Kumbh particular gathering, if it is there. So yeah, the public toilets are also in the nodal areas of the main city, if there is like any road junction or the nodal points, still the peripheral areas are like not covered, though they are having a temporary sanitation facilities during particular gathering, but still it depends ki how much they are like utilizing it or how much they are using that particular facility over that area.
Coming to places of worship, we can see that there is a major concentration of it in the main central zone of the Kumbh area. Next, we have, with the help of the OSM layer that we have put on QGIS, we can also see the places of tourism are majorly concentrated near the transportation lines of the area. Next, we have a slide to discussion where I want you all to have your eyes on the combined map that I have displayed on the screen. Here we can see that there was with the help of the OSM layer, there was coordination between the agencies. It also provided real-time data, which helped spatial. There saw a spatial imbalance in the preparedness, especially in the western and southern region of the map. We can also see the institutional preparedness was there because everybody was accessing the similar data which was provided by the OSM. Then technology and real-time monitoring, we can also use drone and OSM data here to come with technology and real-time monitoring. Sanitation, as discussed before, sanitation health gaps were seen in the map. And lastly, the transportation and crowd management. There are transportation lines, but a very few major transportation lines can be seen, which is again a major cause of crowd imbalance. Next, we have the recommendations to the map. Again, we can also see the combined map on the screen as well. There is a need to establish mobile and temporary units, especially during the Kumbh season in the western and southern regions. And there is a need to promote sustainability and environmental monitoring, especially near the riverbed area. And next we have the interagency coordination, which will allow everyone to access similar data at real time. And next we have, we can adopt GIS-based real-time monitoring systems along with the OSM data that is being provided. We can enhance transport and crowd flow systems, especially the smaller networks that can be seen here can be enhanced better. And lastly, we can ensure equitable distribution of health and sustainable facilities, sanitation facilities as well, especially with the help of temporary spots. Coming to the conclusion of it, assessment can be observed on the map with the OSM data that has been gathered. Next, we have data integration. Integrated data can be also visualized, and the spatial data can be analyzed further. The central zone, as we have seen, it gathered the concentration of all the amenities, which also reflects reflects more work in the southern and western regions. Fire safety, again, we have pointed it out, only one fire station was established. Sanitation, there's a need of more sanitation points in the southern and western region. And next we have technology use, which we can use better with the help of the OSM data, drone technology and everything. Thank you.